Hello, I'm Dr. Robert Sierzolski with Karo Solutions. Today I'm going to be demonstrating a diversified adjustment of the cervical spine. Me as a doctor of chiropractic, I look at the vertebra on different planes of motion to isolate a segment to see which way I want to adjust. So first of all, I look and see which segments need to be adjusted. Secondly, I look to see which plane of motion is going to be the best way to adjust. Looking at this view of a spine over here, there's a couple different planes of motion with a chiropractic thrust that we can look into thrusting. It can be into extension, lateral flexion, which will be a sideways bending of the spine, or rotation. A lot of times, many of my adjustments will be a combination of all three motions, what we call coupled motion. But my hands are my eyes in this type of profession, so I'm going to go ahead and demonstrate this on my next patient. So what I'm doing over here is I have the patient nice and relaxed with the table with the headpiece in flexion. I look and I palpate different segments over here to see which segment will be the most restricted in motion. I also look for swelling of the joint capsules. And what I found in this patient's case was C6. I look in extension, lateral flexion, and rotation. And it seems to be rotation and extension are going to be the most restricted. So I have the patient relax. This adjustment's over in half a second, and it's a gentle thrust, and that's it, and it's over. I'm going to go ahead and go to the other side. Motion palpate as well. There are 7 segments within the cervical spine. And I look to see which one is going to be the most restricted. In this case, it's going to be C5 and C6. Extension, lateral flexion, and rotation. In this case, all different planes of motion are restricted. That's it. It's a quick adjustment. And it's over. How do you feel?
Great.
Wonderful.